So, Louise, you're almost famous now in the science policy community for emphasizing the need for evidence-based policy.
Yep.
I was wondering if you could maybe just tell us a little bit about what exactly it means for policy to be evidence-based in contrast to not evidence-based.
I think it's a good question. And it's not necessarily a very easy one to answer, because I think there's not necessarily a gold standard for evidence-based policy versus a silver or bronze standard, or even a black standard for evidence-based policy. It's a question of having 4 different types of evidence. And being able to use those different types of evidence strategically. So the first thing you need good statistical data, because data gives you a picture of where you are now. It gives you a picture of what is the current situation, whether that be environment, whether it be public health issues. You need to have good statistical data, and you need to have long-term statistical data so that you can do projections and you can do models. You also need to have analytical evidence. Analytical evidence is what you would get from research. It tells you why and how you got to where you are now, and where you might be going in future. So it's research-based techniques, it's models, and it's possibly even a little bit of horizon scanning and projection. Although I think what horizon scanning and projection does is that tells you what people are likely to value. And that's the third type of evidence you need, which is evidence from your stakeholders of what they value and why they value it. And it's about, it's not just about researching citizen opinion, it's also about the more sort of tacit information that you get from meetings with stakeholders, meetings with industry bodies, meetings with expert advisory groups, just to understand where the wind is blowing. So you can get robust evidence on values from doing systematic reviews, but evidence on values and on stakeholder perceptions of policies is also about a little bit more of that tacit knowledge as well. And then the final type of evidence, the fourth type of evidence that is as important, is the contextual evidence, which is evidence that you get from knowing what has worked in the past. So as soon as we try and implement policies and programs, we run into the complexity of the delivery process, of the implementation process. And knowing what has been cost effective, what is likely to work in the past, will give us good pointers for what is likely to work or what is likely to not work in the future. So I think there are 4 types of evidence. There's data, analytical evidence, which is the research-based evidence, evidence from stakeholder opinion, and contextual evidence. And having an evidence-based approach to policy means being able to use those 4 types of evidence strategically to achieve the policy goals. And I think it's a fairly simple framing, I think, but actually when you unpick it, it becomes extremely complex, because taking that strategic approach means unpicking what those policy goals are, to whom are they important, how are you going to measure progress, what's the data that you're going to need to collect in order to measure progress. If you can't collect the data that you need within the budget, are you asking the wrong question? Lots and lots of iterative feedback loops in all of those questions. And that to me is the policy making process. It's negotiating whether we've got the evidence, whether we have got the resources to collect the evidence that we need to demonstrate progress towards the goals that we have.
So you would see evidence-based policymaking as good policymaking, whereas not evidence-based policymaking would be bad policymaking.
Yes, I think all policies are based on evidence. The question is whether the policy process is a good process, makes good use of that evidence, and whether the evidence itself is good. So I often have a little diagram with crossed arrows, because if you've got fantastic evidence and put it through poor policies, through poor policy making processes, you'll get poor policies. If you've got if you've got bad evidence but put it through good processes, you're still going to get poor policies. You only get good evidence-based policy making when you've got good evidence and put it through good processes.
Makes a lot of sense. So being here at CSPC, what is your impression of the conference venue and the possibilities for something like this in assisting in bringing about good evidence-based policy-making processes?
I think it's a really good start. I have to say I'm blown away by the level of participation, particularly from the bureaucracy, from the civil servants at federal and at state level here. I think it's amazing that you've managed to get 2 ministers to speak here and to get the level of Deputy Minister and ADM to come and sit on panels and participate in the discussions, and to actually commit to staying here for longer than a day. I think all credit to the organisers for doing that. It shows it shows the maturity of the science policy debate in Canada, which I think is great. It's different in the UK. And it's not necessarily, you know, a good thing or a bad thing that they're different. I would just say that it's different. But I think having that level of representation from the bureaucracy means that you get the face time that's really important. It's not simply a matter of getting great evidence and giving it to a bureaucrat and saying, go do something with it. It is actually that interpretation process. And allowing the civil servants to be able to question the people who are presenting the science and to say, well, what does this actually mean in terms of what it is that I'm trying to accomplish? And I think that's another part of the evidence-based policy making process, is that it's not just a question of supply meeting demand. There's a brokering that needs to take place in the middle, because quite often a research project, for example, can take 3 years to run. In that time, the policy question will have changed. So the research will be answering an old question, and policy will be asking a different question. So if you simply present the results of research to the policymaker who is asking a different question, it's not that the research is bad, and it's not that the research is wrong. It's that there needs to be this interpretation process of meaning, of what does it mean for what it is that the policymaker is now trying to achieve. And so we had a knowledge brokering and translation workshop on Wednesday before the conference started. And again, really good representation, a lot of interest from civil servants who came to try and understand how they can implement this sort of brokering program in their departments.
That's all very interesting.